Hi everyone, I'm Brandon and welcome back to News4Teens. In the US, those who are 16 and over are now eligible to get a COVID-19 vaccine. Recently, a lot more people that I know have now had their first vaccine shot, including my parents and older friends. Because there are so many different vaccines globally, I thought it would be helpful to talk a little bit about the technology behind different types of vaccines. I'll also highlight the top approved COVID-19 vaccines and what approach they use. Before I go into these topics, it helps to have a basic understanding of how our body fights diseases. In order to fight an infection, our immune system uses several germ-fighting tools, which usually involves different types of white blood cells. Typically, the first time you're exposed to a germ, it takes some time for your immune system to learn how to fight it. But once you've recovered, in most cases, the next time the body encounters that same germ, your body will typically recover faster since it will recognize the germ and remember how to fight it. As children, we get a number of vaccinations, such as measles, polio, and tetanus, to help prepare our body with a memory of defense responses to different illnesses. When it comes to vaccines, there are different technologies and approaches to creating a vaccine. For example, in the past, I've talked about mRNA vaccines. That's just one type of vaccine technology. At a high level, vaccines can be divided into two platforms: component vaccines and whole vaccines. Whole vaccines include a version of the entire pathogen, while component vaccines include only a partial piece of the pathogen. In this helpful visual, I've circled in red the vaccine types used by the COVID-19 vaccines that have been approved by at least one country. Let's take a closer look at these four approaches. The first is a protein subunit vaccine that uses a harmless piece of protein from a virus instead of the entire pathogen. In the case of COVID-19, the protein used is often based on the spike component of the SARS-CoV-2 virus. Once given a protein subunit vaccine, our body recognizes that the protein is foreign and remembers how to fight it. In the future, when we're exposed to a virus with the same or similar protein, such as the spike protein in the case of COVID-19, our body can recognize the pathogen and already knows how to fight it. The second approach is an RNA or messenger RNA-based vaccine. This type of vaccine uses genetic material from a virus, giving our cells instructions on how to make a component of the virus, such as the spike protein of the SARS-CoV-2 virus. After our cells make copies of the protein, they destroy the genetic material from the vaccine. Once again, our body recognizes the spike protein as foreign and remembers how to fight the virus, so that if we are infected in the future, the body will have an easier time fighting it. Next, we have a non-replicating viral vector vaccine. This approach uses a version of a different virus, but modified so that it cannot replicate or copy itself. This approach uses what's called a viral vector. Inside the shell of the modified virus, there's material from the virus that causes the illness we're protecting against, such as COVID-19. For example, the adenovirus, which causes the common cold, is one of the viral vectors used in some COVID-19 vaccines. Once the viral vector vaccine is inside our cells, it operates similarly to the mRNA vaccines. The last one I'll mention here is a whole vaccine approach used by some of the approved COVID-19 vaccines. These approved whole vaccines are all inactivated vaccines. They use the killed version of the germ that cannot replicate. Globally, there are currently 14 approved COVID-19 vaccines with more than 100 others in clinical trials. Here's a list of the top 7 of the 14 approved vaccines based on the number of countries they have been approved in. Currently, there are 3 approved in the US. The Pfizer-BioNTech and Moderna vaccines are both mRNA-based vaccines. The Johnson & Johnson vaccine is a non-replicating viral vector vaccine using the adenovirus as a viral vector. The Oxford-AstraZeneca vaccine is in phase 3 clinical trials here in the US and relies on methods similar to Johnson & Johnson. The Maryland-based company Novavax has developed a protein-based coronavirus vaccine that has not yet been approved for use in any country, but is also in large-scale clinical trials here in the US. There are approximately 20 other vaccines in clinical trials in the US. Almost 140 million people in the US have received at least their first COVID-19 vaccine dose, which is about 42% of the total US population. Approximately 95 million people in the US are fully vaccinated, which is about 28% of the population. We're heading in the right direction. I think it's worth mentioning that while the US has significantly improved our vaccine rollout, this is a worldwide problem. Many other countries are having a hard time responding to the pandemic, including getting adequate vaccine supplies. This is a problem that needs to be addressed globally, which I hope to talk about another time. I have more videos to come related to COVID-19 and the vaccines. Thank you for watching and hope you learned something new.